Dr. Foster, healthcare analyst, has said that hospitals should run at about 85% capacity to cope with the demand in surges. Some hospitals are having 95% occupancy rate, which causes a real strain. Patients Association Chief Executive Catherine Murphy said these distressing figures reveal bed occupancy rates are at the very limit of what is safe or indeed desirable for patients. The report says that many hospitals are fit to burst, which could create a dangerous environment for patients. Its report, which included 145 hospital trusts, said that when hospitals were too busy, patient care suffered because systems were breaking down. Roger Taylor is one of the founders of Dr. Foster and explains just how bad the overcrowding is.
When we're at a point where some hospitals are literally reaching 100% occupancy, that's when things start to get really problematic. It's an amazing thing, but actually hospitals can be over 100% occupied. In the middle of the day, sometimes hospitals have admitted more patients than they actually have beds for, and they're having to discharge patients in order to get them into the bed. So the level of occupancy often is really very, very high. And what we found was that a large number of them, almost a third of patients in hospital beds, were people who it might have been possible to manage them in a way that they didn't need to be in hospital. This is an issue for the whole health system. It's about community care, it's about community hospitals, it's about primary care, and it's about social care as well as hospital care.
The analysis showed also that 29% of beds were taken up by patients that didn't necessarily need to be there. 3% of hospital beds are taken up by those with dementia, and more than 10% had conditions such as asthma or heart disease that could be treated in the community. Dan Poulter, Health Minister, says that the NHS need to work on preventing people from being at hospital who don't need to be there.
The big challenge for the NHS, as I said, is making sure that whilst we can be reassured the NHS does have the capacity to look after patients even during busy times, if they become very unwell and get into hospital, that we actually focus the attention more on preventing people who don't need to be in hospital from being there in the first place.
At a hospital in South Devon, they are working hard to ensure that they have spare beds available by not keeping people there longer than they need to be. Paula Vasco-Knight is the Chief Executive.
We start off by saying if patients can stay at home, they should stay at home. If a patient needs to come into hospital, they will come into the hospital for the minimum amount of time, and then we get them back home with a care package wherever possible.